we know that over the weekend there was a forum that was held that talked about concerns when it comes to maternity services. The Our Birth, Our Voice Forum, highlighting many families in the Northern Territory are choosing to relocate interstate for maternity care. What immediate actions is the department taking, not only to stop people leaving, but to provide that continuity of care that women are really calling for?
Look, the immediate action we're taking is that we've just recently spent around about $300,000 on really some cosmetic changes in the maternity. But look, we want to ensure that we have choice for families here in Darwin. And the issue at the moment is that we do know that 𝘿𝙀𝘾𝙇𝙄𝙉𝙀 in administration, but what we have done is we've had communication with the federal government. We've also had communication with the receivers, the administrators that are looking at the possibility of new buyers of the private hospital in Darwin. So we've kept in close contact with them, and what we want to do is be in a position that when a new...
Oh, we seem to have lost the Minister. Hoping that I have got the Minister on the line. Steve Edgington, I do apologise for our tech issues. Can you hear me?
I certainly can, Katie. I wasn't sure whether it was your end or mine.
I know. Well, look, while I've still got you, a couple of really quick ones because I know you're pressed for time and I appreciate you staying on hold. We know the forum heard on the weekend that NT Health funding, that request from the Commonwealth, you guys requested $35 million when it comes to maternity services. It was revealed that it may not be that much. How much is it going to be from your understanding?
Look, we've always asked for $35 million, and I've been corresponding with the Federal Minister, Mark Butler, and we've had some good discussions about this. But the latest update in regard to the funding is that the federal government has suggested that an offer of around $10 million would be more in line with Tasmania and New South Wales. So at the moment, I'm just waiting to hear back from the Federal Minister around where we go, whether it's the 35 or the 10 million, but it's looking more likely to be a $10 million package.
$10 million? I mean, are you disappointed? That's $25 million less than what you'd requested.
Katie, look, I'm extremely disappointed because we want to make sure that our maternity ward meets the very highest standards so that families have the very best birthing experience. But look, at the moment, when it comes to funding right across the Northern Territory at the moment, what we do know is that we're already $200 million short per year with the National Health Agreement. But also, we're about $186 million short when it comes to other funding. As I said before, it's costing us $40 million to look after aged care patients, which we like to do, but it's a federal responsibility. It's costing us over $50 million a year to provide a care flight patient retrieval service, and we're also putting $95 million into primary health care, which again is a federal responsibility. So we're already $400 million a year short. So we're hoping to get the best possible outcome.
Minister, just really quickly before I let you go, I mean, with only, I'm hesitant to say only because $10 million is still a heck of a lot of money, but with $10 million rather than 35, what are you actually going to be able to deliver?
So with the $10 million, look, it'll be some very minor capital works, and what we want to do is improve the rooms where mothers are giving birth. We want to ensure that there's proper facilities where there's not only a refurbishment of some of the rooms, but an expansion and hopefully some additional rooms, but that's unlikely with $10 million. So it'll be mainly a refurbishment of the maternity ward at 𝑘𝙁𝙁𝘀.
I know that's going to be so disappointing for people to hear this morning, and I don't want to sound ungrateful to the federal government, but $10 million, and when you look at what that's going to do comparatively to what we need, seems like a bit of a kick in the guts.
Well, it is disappointing. So the maternity ward is, look, it's a very aged facility, so any upgrade is very important because we're talking about years and years of no upgrades being done in that particular space. So $10 million, look, we would love to get the $35 million because we want to make sure that mothers have the very best birthing experience. But we are hopeful that once a buyer for the private hospital is identified, we can get to the table, have some serious conversations about ensuring that maternity services also come back to the private hospital.
Maternity services. Now, we know there's a couple of issues sort of bubbling along here. Obviously, we heard the forum on the weekend where a number of Northern Territory women and families met at that forum to really voice their concern. And that is part of the closure of the maternity services, obviously, at the Darwin Private Hospital. But what we're also hearing then is that we've got a public hospital, the maternity services at the public hospital, that are under stress. Women want that continuity of care when it comes to birthing, and it's something that they feel that there is serious flaws at this point in time. I mean, Selena, you attended that forum on the weekend, and some of the stories were harrowing, weren't they?
Oh, absolutely, Katie. And I think when the community comes together, it doesn't matter where from, they're talking about the different experiences that they've had. You know, many shared positive experiences with the maternity service that they have received. Many shared those fairly heartbreaking stories about the loss of a child or loss of an infant, and, you know, coming together, that power of the community. So there really does need to be a bigger spotlight from the CLP government. I know that there's been the $10 million that the federal Labor government has provided, and that's more than what Tassie got, which is great for us, for the Northern Territory. But in terms of really starting to address these serious issues that are being brought forward by Territorians, by families, by our health workers, by our health professionals, I think is something that the CLP government is not providing that plan, not providing that certainty. People don't want those excuses anymore, Katie. They want to know, what is the government doing? How are they working with the federal government to really make sure that maternity services right across the Northern Territory are supported in the way that Territorians deserve?
Look, on this, I want to say, I mean, $10 million comparatively to the 35 that had been requested, I think is a kick in the guts for Territorians when you look at our maternity services and what we require, and when you look at the fact that our health service is trying to deliver, you know, maternity services across what is an incredibly vast, in some cases, you know, you've got women coming in from remote areas to have babies, and then you've got, you know, all of our defence families. Like, it's such a vast range of people in the Northern Territory wanting to have their kids here. Now, $10 million, I don't want to sound ungrateful, but comparatively to the $35 million that had been requested, is really not up to the standard that we expect. But in addition to that, this argy-bargy between the Northern Territory and the federal governments on this, I'm going to call it's bullshit. You know, we got an email yesterday from Luke Gosling saying, you know, that they hadn't received the level of information that was required. Well, for goodness sake, if that letter or that proposal went through in June or July this year, why hasn't somebody sat down with the Department of Health or whoever needs to sit down together to work it out so we can get bloody 35 million rather than 10?
Absolutely.
Yeah, Katie, I think you've hit the nail on the head, and we're understanding more and more about the change of that figure because I'm obviously following this very closely. My Deputy Opposition Leader, 𝘿𝙀𝘾𝙇𝙄𝙉𝙀, has been in Canberra. He's met with both the Health Minister this week in his shadow portfolio as Health, as well as Minister Sam Ray around aged and disability care for Territorians. So there's some really interesting information, but we're now understanding that the $35 million was around basically a propping up of the private maternity services, not a commitment around Royal Darwin Hospital. Now, I don't think that has been made clear by the CLP government when they've been in those negotiations and providing that really important information to Territorians and our health professionals about that figure. So my understanding now, Katie, unpicking it further, the $10 million, it will go to Royal Darwin Hospital to support our maternity services and the great work that our teams do there to support women in the Northern Territory receive that very important and vital care. But the $35 million we're now understanding was not for Royal Darwin Hospital, it was for the private maternity service. So the government, again, is going out and asking and deflecting what are their plans around maternity services for Territory women.
Yeah, thank you, Katie. And I think this is really important. So we've obviously seen over the period of time, we've had the private hospital shut, and this has been an issue because then we've needed to obviously support women and families through that process at Royal Darwin Hospital. In Alice Springs, we only have the public hospital. My wife has given birth to our two beautiful girls girls there, and the support that we received there was absolutely incredible. In one case, we were there for 11 days. Midwives, we couldn't speak highly enough of them.
Yeah.
The stories we're hearing coming out of Darwin is that we do need more resources to be able to support families through that, and we're working with the federal government to enable that to occur. And the private hospital is absolutely a really important part of that, because if we want to give families that come to a major capital city like Darwin the option to go the private route, that's an option they should be afforded. And I think this isn't an either or. This is, we're working with the federal government, who are currently working with 𝘿𝙀𝘾, along with our public hospital here, to ensure that all services across maternity can be improved, and in the case of the private health centre, can be returned. That's a really important thing, and I think I've even heard the Chief say, as part of that private health deal that's going to be struck with the feds, we're trying to ensure that in that deal they must provide maternity services. So that's a really important thing that we're working with the federal government on, and I completely agree with you. We need to be working more hand in hand rather than taking shots at one another, because no one wins in that case. We just want to see families better looked after.
Yeah, I think that's important.
Josh, can you confirm, is the 35 million, was that to prop up the private maternity services, or was the 35 million for the Royal Darwin Hospital and the public hospital service?
Yeah, I don't have that level of detail in front of me, Selena, but at the end of the day, like I said, we're working to ensure that we can restore maternity services up here in Darwin.
And I think, once again, this is another case of the regions missing out.
Yeah.
We were at that forum as well. and one of the other important elements, and you touched on it, Katie, is the Defence Force families. Now, we know that Defence Force families, people in the Defence Force who have families, their preference is not to come to Darwin now. They're saying we don't want to come to Darwin because we don't have the medical services there in Darwin.
Which is shocking.
Which is terrible, because now that's people who, that impacts our population, but it's also the Americans as well. We know that Americans will be looking to build their forces here. We know that's going to happen, irrespective of people like it or don't like it. We know that will happen in the future. They're in the same situation. They want to know that the proper medical facilities are here for their people. So
Absolutely.